Good afternoon, everyone. Again, I'm Juan from Alameda County Social Services. Thank you, everyone, for coming to this training. I'm, again, a associate program specialist with the Medi-Cal program with Alameda County Social Services. And today I'm going to be talking to you a little bit about what the county basically looks at when determining eligibility for individuals for the Medi-Cal program. So on the next slide, we will see some of the learning objectives for today. So the first of which is one of the major driving factors when determining eligibility for Medi-Cal is the financial requirements. So we're going to look at how we determine eligibility for the Medi-Cal program with regards to financial requirements. We're also going to be looking at other eligibility requirements, specifically for the Non-MAGI program. And I'll explain what non-Magi and Magi is in a little bit, but non-Magi involves a little bit more than just the financial aspect, so we'll be looking at what else goes into that. And then lastly, we'll also be looking at the scope of coverages that are available, so either full scope or restricted scope benefits, and it's based on your citizenship or your immigration status. And then at the end, we will have time for addressing a couple of questions, but we also did get a few questions with regards to the Medi-Cal program during this whole COVID-19 situation before the presentation, and we'll be answering some of those before we get into whatever questions. So it was mentioned earlier, but yeah, so feel free if you have any pressing questions to, stop me in the middle of the presentation, or if you want to reserve it for the end, we'll also be looking at the chat to collect some of your questions. Okay, next slide, please. All right, so first, what is Medi-Cal? Medi-Cal is the Medicaid program in California. So Medi-Cal is just our California's name for the Medicaid program. And it's a joint federal and state program that helps pay Medi-Cal costs for people who have limited income and resources, and as long as they meet the other eligibility requirements. Next slide, please. All right, so it is a public health insurance program, and it covers low-income individuals, including but not limited to families with children, seniors, so individuals 65 or older, individuals with disabilities, foster care individuals, as well as pregnant women. And the reason we separate pregnant women as its own category is, as you might see later, there are some special not really requirements, but there are different benefit levels that you can get when you're a pregnant individual. Next slide, please. All right, so as I mentioned earlier, we have as far as the county is concerned, there are two major methodologies that we evaluate an individual for Medi-Cal eligibility with. The first of which is Magi. And so to kind of explain, there is what we call a Medi-Cal hierarchy when we evaluate an individual for Medi-Cal as far as the county is concerned. And so the first part of that hierarchy that we go through is Magi Medi-Cal. And what Magi stands for is Modified Adjusted Gross Income. And the way that this works is we determine eligibility based on IRS income calculations for tax purposes. And there are multiple coverage groups with different income limits depending on which group you belong to. And they vary again based on age and pregnancy status. And some of those coverage groups, specifically the OTL ICP coverage group, has a premium amount attached to it. And that's if your income is a little bit on the higher side of the Medi-Cal eligibility. Now, OTL ICP is the optional targeted low income children's program, and it basically allows other children who would be otherwise ineligible for Medi-Cal because of income limits to still get that full scope Medi-Cal, but it does carry that premium. Next slide, please. All right, so again, there are four major Magi Medi-Cal groups, and the first group would be adult individuals 19 to 64 years old, and they are eligible for Medi-Cal if their income is up to 138% of the federal poverty level. The second group is infants and children under 18 years old, and this is where that OTL ICP comes into play, where they're eligible for Medi-Cal if the household's income is up to 266% of the federal poverty level. Then you have parent and caretaker relatives, where if their income is up to 109% of the federal poverty level, they are eligible for Medi-Cal. Now, if you notice, parent and caretaker relatives, um, their income um, their income eligibility is a little bit lower than the other previous two groups, but if they don't meet that requirement for the parent caretaker relative, we would then evaluate them for the adult individual group. So it still kind of balances it out. And then lastly, as I mentioned earlier, as you can see for pregnant women, we do allow them to go a little bit higher on the federal poverty level scale. So if your income is up to 213% of the federal poverty level, you'll qualify for some type of Medi-Cal. All right, next slide, please. So as I mentioned earlier, one of the biggest driving factors to determine eligibility for Medi-Cal is income. So we're just going to go through some of the types of income that are counted for Medi-Cal, specifically for now Magi Medi-Cal. Now, I know that there are a lot of income types, and we're definitely not going to be able to cover them all, but rest assured that when you're assisting someone, for example, with an application and they don't know if their income is counted or not, really my best suggestion for everyone is just to report any type of income that the applicant is getting, and the worker will definitely work with the applicant to make sure that we're counting what needs to be counted and we're excluding what needs to be excluded. So just going over some of the types of countable earned income for Magi Medi-Cal. Of course, we have wages and salaries. We also have tips, commissions, as well as profits from self-employment. Next slide, please. All right, and then some types of unearned income that are counted towards Magi Medi-Cal. We have unemployment, we have SSA income, so disability, survivor, and retirement income, but just the taxable portion for that. We also count retirement income such as IRAs, pensions, 401ks, military income, as well as railroad insurance income. And then we also have rental income, annuities, dividend payments, as well as per capita tribal gaming distributions. Next slide, please. Some of the things that we exclude for as income for Magi are child support, veterans benefits, educational assistance, employment and training programs, earned income tax credit and federal tax refunds, bona fide loans, employment and training programs, sponsor income, foster care payments, as well as needs-based assistance from other agencies. Next slide, please. All right, so I mentioned a hierarchy earlier. So if you don't meet the requirements for Magi Medi-Cal, there are kind of two things that can happen. If you meet one of the eligibility groups, which I'm going to discuss later, you would then be evaluated for non-Magi. Otherwise, if you don't meet one of those eligibility groups, we would sometimes be able to refer you to Covered California to pick a plan with them. So that plan may have like co-pays or a monthly premium that you have to pay, and it's not really free, I believe, any of the time when it's Covered California. However, there is still that subsidy, so it's still going to be at a lower cost. But again, that depends on your income. So looking at non-Magi, I mentioned that it's not only income that we look at, it also requires an asset test. So there is a property aspect to non-Magi Medi-Cal. And to be evaluated for non-Magi Medi-Cal, you would either have to be age 65 or older, blind or disabled, pregnant, and then under the age of 21, or a parent caretaker relative of a child under 21 in the home. Now, those last two, those are specifically to do with cash-linked Medi-Cal programs. So, for example, other aid programs that the county offers, CalWorks, for example. When someone applies for CalWorks, they're automatically evaluated for Medi-Cal as well. There's a Medi-Cal aspect attached to that. So that's where those two categories come into play. I don't believe outside of that there really is much non-Magi that has to do with those two categories. They would usually be in the Magi category or would be referred to Covered California if they're over that income limit. And then lastly, for non-Magi, there is possibly a share of cost involved. So that depends on your income. And what a share of cost is that you have to cover that, the applicant or the recipient has to cover that share of cost before Medi-Cal will start paying for any services. Next slide, please. And so again, just to kind of expand on the things I mentioned earlier, again, the Medi-Cal groups for non-Magi Medi-Cal are aged individuals 65 or older, disabled or blind individuals, individuals in long-term care facilities, also known as LTC facilities, individuals who are receiving Medicare, particularly Part A and B, and then individuals or families eligible as medically needy with dependent children. And again, that's to do with cash link programs. And then also there are special programs for refugees if they don't qualify for Magi Medi-Cal. Next slide, please. All right, so some of the things that we count towards non-Magi Medi-Cal, so for earned income, obviously wages for labor or self-employment, and then aid in exchange for any services. For example, you're able to stay in someone's house in exchange for some type of manual labor that you do in that house. And then on the unearned income side, you have Social Security benefits, unemployment benefits, state disability income, veterans benefits, annuities, dividends and interest income, child support, aid in kind, not in exchange for any type of labor. And then we also count some non-exempt financial aid. We also count any type of cash gift over $60 per quarter or 3 months, retirement and pension income, as well as alimony. And what you can notice here, especially on the unearned income side, is that a lot of the things that weren't counted towards Magi Medi-Cal are actually counted. I'm sorry, a lot of the things that weren't counted towards Magi Medi-Cal are actually being counted with non-Magi Medi-Cal. Next slide, please. And then, as I mentioned earlier, there is that property aspect for non-Magi Medi-Cal. So with the income aspect, if you're over a certain type of income for non-Magi Medi-Cal, you would go into a share of cost. However, with the property aspect of this, of non-Magi Medi-Cal, if you go over that property limit, then there are still some programs that that we can kind of see if you're eligible for. But generally, if you're over that property limit, then you wouldn't be eligible for non-Magi Medi-Cal. So so what that property limit is basically saying is just for a household of one, the property limit is $2,000. If there's two people in your household, it's $3,000. And then if any number greater than two people in your household, you would just add an additional $150 for each member in the house. And then some of the types of property that we count for non-Magi Medi-Cal, of course, we count cash bank accounts, credit union accounts, trust accounts, stocks and bonds, fair market values of cars, where one car is usually exempt, and that car is usually the car with the highest value. So that gets exempted from the counted property. We also have cash surrender value for life insurance policies, and then we have also the 401k. Next slide, please. We also do count real property as part of the property reserve, is what we call it for non-Magi Medi-Cal. However, the primary residence is, of course, exempt. For other real property, we would only count it as exempt if the value is $6,000 or less, and if there is a net income from that property that's 6% or more of its net market value. Otherwise, if it's over $6,000, it would be counted towards that property reserve. Next slide, please. Okay, so now we've kind of discussed a little bit about what the difference of Magi and non-Magi is. Now we're going to look at the different coverage levels that you can get. And this is largely based really on your citizenship or your immigration status. So full scope benefits is exactly what it sounds. It pretty much covers all, if not most things. So outpatient services, of course, are covered, emergency services, hospitalization, maternity and newborn care, any type of mental health and substance use disorder services, behavioral health treatments, of course, are covered, prescription drugs, dental care, physical and occupational therapy, lab services, preventive and wellness services, as well as children's services. So that includes vision for children as well. Next slide, please. So if you aren't covered by full scope coverage, then you would be under restricted or limited scope Medi-Cal benefits. And basically that's just restricted to either pregnancy related services, emergency related services, or long-term care services, depending really on what type of aid you're eligible for. So if you're in a long-term care facility, for example, then the aid code that you would get more often than not is usually restricted to just that long-term care service. Next slide, please. So here's just a little chart. It's a lot of words, but basically what it's to kind of sum it up, it's basically just explaining who is eligible for full scope and who is eligible for just the restricted or limited scope benefits. And we'll kind of go through those groups in the later slides. But so for full scope benefits, US citizens, of course, individuals with satisfactory immigration status, and any individual up to their 26th birthday. So as long as they're under 26, regardless of their immigration status, they are eligible for full scope Medi-Cal. Also, anyone who's under PRUCOL and DACA status, they're eligible for full scope benefits. And of course, this is all as long as they meet the other requirements, such as income, and then residency, for example, as long as they're a resident of the county. Um, then as long as they meet all those other eligibility requirements, they're eligible for full scope benefits. Now, who is left on the restricted or limited scope benefits? So basically that's anyone who's undocumented over, so 26 and over, and then anyone who's unable to provide verification that they're a US citizen or eligible immigrant. So you have three eligibility, so you have three types of aid here, basically someone who doesn't have a share of cost. So that's either Magi or non-Magi without a share of cost. You have Medi-Cal with a premium, such as in the case of the OTL ICP group, and you have Medi-Cal with a share of cost. So really the only difference between those two groups is on the full scope side, you can use any of the benefits attached to that, to whatever aid type you're on. But on the restricted side, again, you're only restricted to emergency or pregnancy related services, or if you're on an LTC code, then you would be restricted to the LTC services. So that's pretty much what this slide is talking about. Okay, next slide, please. So yeah, so now we'll kind of go into the whole immigration side of it, basically kind of explaining those different eligibility groups. Next slide, please. Next slide, please. Okay, so first, we keep talking about satisfactory immigration status, and basically satisfactory immigration status is covers some of these groups, and this isn't everything, but yeah, the most common groups are, sorry, back please. Yeah, there you go. So first is lawful permanent residents. So if you have a green card, refugees, Cuban and Haitian, um, parolees admitted with a period of parole over 1 year, asylees, and victims of trafficking. So those are the major groups for individuals with a satisfactory immigration status. Now, I'm sure, again, that there are a lot of immigration statuses and we won't really be able to cover everything. But as I mentioned earlier, definitely the worker assigned to evaluate the case will be able to figure out if an immigration status is considered as satisfactory immigration status and what type of aid that individual qualifies for. Okay, next slide, please. All right, so PRUCOL, I mentioned this earlier, and what PRUCOL means is permanently residing under color of law, and there are 16 categories for PRUCOL. And if an individual is under PRUCOL status, they are eligible potentially for full scope Medi-Cal benefits, again, if otherwise eligible, if they meet all the other eligibility requirements. And the reason why this is on a separate slide and not under the satisfactory immigration status side is because, unfortunately, USCIS does not recognize PRUCOL as a legal immigration status. Next slide, please. And so I mentioned earlier that if you're under the age of 26, regardless of your immigration status, then you qualify for Medi-Cal regardless of your immigration status. And really that's in large part due to the two bills that I'm going to be kind of talking about a little bit right now. So the first of which was Senate Bill 75, which took effect back in May 2016. And with the passing of that Senate bill, all children under the age of 19 would be potentially eligible for full scope Medi-Cal regardless of their immigration status or verification of their citizenship. Next slide, please. And then, yeah, so earlier this year, just in January of this year, we also got um, the we also got another bill passed, California Senate Bill 104, and this expanded Senate Bill 75 to basically also now. So now we we are now also able to potentially make individuals from 19 to 26 eligible for full scope Medi-Cal coverage. And again, this regardless of their immigration status or verification of their citizenship. This wasn't really this isn't really included in any of our slides, but there are plans on the state level that got postponed unfortunately due to the situation we're in. But the next coverage group, if it if the state is able to get it through, would be to extend full scope coverage to aged individuals over 65, regardless of their immigration status. But again, that has not been passed. But it's something to look forward to in the future, and hopefully, within the next few years, that is something that gets passed. But right now, so the only ones who qualify, regardless of immigration status, is anyone under the age of 26. Okay, next slide, please. And then, so I also talked about DACA earlier, and DACA stands for Deferred Action for Childhood Arrivals. And so individuals who fall under DACA are potentially eligible for full scope Medi-Cal under the PRU-Call provision. And unfortunately, per federal guidelines, DACA individuals are not eligible to purchase a plan through Covered California. So I mentioned earlier that one of the tracks that that an applicant can go through is if they don't qualify for Magi Medi-Cal, is that we can refer them to Covered California to pick up a subsidized plan. Unfortunately, that is not available for DACA individuals. Next slide, please. And then we also talked about trafficking and crime victims earlier. So non-citizen victims of trafficking, domestic violence, or other serious crimes who don't have satisfactory immigration status may still qualify for full scope Medi-Cal under a special program. And that special program is what we know as TCVAP, or Trafficking and Crime Victims Assistance Program. And it covers victims of severe trafficking who have filed or are preparing to file for a T non-immigrant status, or T visa, or taking steps to get certified by the U.S. Office of Refugee Resettlement, or ORR. And it also covers victims of domestic violence or serious crimes who have filed or have been granted a U non-immigrant visa, or a U visa for short. Next slide. Okay, and then I'm pretty sure this is one of the last ones. We do also have refugee programs, and with the implementation of the Affordable Care Act back in 2014, as I mentioned, low-income adults under the 138% of the federal poverty level without children or disability qualify for Magi Medi-Cal. So individuals with a status of refugee, asylee, parolee over 1 year, Cuban or Haitian entrants, Amerations, victims of severe forms of trafficking without children or disability are no longer limited to 8 months of eligibility under the Refugee Medi-Cal Assistance Program. So there is a cash program that's kind of linked to this, and it's called Refugee Cash Assistance. That is still limited to 8 months from the month of entry if you meet one of these statuses that I just mentioned. However, the change brought about by the Affordable Care Act is that that individual now qualifies potentially for Medi-Cal past that 8-month period. So if an individual does not qualify for Magi due to income, they are still able to get refugee Medi-Cal assistance, either with or without a share of cost. But that is only available for 8 months from the month of entry, along with the cash assistance program. All right, next slide, please. If an applicant wants to find out what the status of their application is, or if you're already on Medi-Cal, for example, and you want to know about your case, so you want to know things like your case status, you want to request for verification letters, or basically proof that you are receiving benefits. You want to request for certain forms, or you want to know what your benefit amount is if, for example, you're receiving other programs like CalFresh, CalWorks, Refugee Cash Assistance. We do have a 24-hour automated service line. And that number's right there at the bottom, 1-888-999-4772 or 510-263-2420. And there are a lot of there are a lot of automated services that'll basically tell you just the basic information about your case. However, this is also the same number you would call if you wanted to reach a live person to ask more complex questions. And the person who will answer the phone is going to be an eligibility worker, so they'll be able to look into the case as long as you have the authority to talk about that case. So either you're either if it's your case or if you're the authorized representative for the case, as long as we're able to verify that, we'll be able to discuss the case with you and talk about more complex information, talk about like what kind of documents, for example, you need to submit for recertification, those kinds of things. More complex questions, you can also speak to a live person from 8 o'clock to 5 at that same number. But yeah, that's pretty much it for that. Next slide, please. We also do have offices at these 6 locations. Right now, because of the whole public health emergency due to COVID-19, our lobbies are closed. However, there are still staff in those offices, and we are still accepting walk-ins at a limited capacity. But if you have questions about your case, if you want to submit documents, if you want to ask for documents, there are staff available at our offices. We do recommend making use of telephonic and online services, but absolutely, if a client does not have access to technology, then absolutely our offices, we have staff in our offices that can help you. Yeah, so that kind of leads me to the question portion. We did get a few questions regarding the whole COVID-19 situation. So I think, yeah, we can move on to the next slide, please. Yeah, so the questions portion. So I think there might be a few questions in the chat, but I'll go ahead and address some of the questions we got beforehand. And I'm sure a lot of people want to know the answers to these questions as well, because it has to do with basically what the Medi-Cal program, what any changes in the Medi-Cal program during this whole public health emergency situation. So the first question we got was regarding whether applications are still being accepted, and if there's anything that changed with the application process. With regards to new applications, nothing has changed basically. So the thing about Medi-Cal is it's all largely done without any type of face-to-face interaction being required. So absolutely, we are still accepting applications, and we are still working on processing those applications. And in fact, we're prioritizing applications just to get as many people on aid during during this kind of situation. The only thing I say that would have changed is at a limited capacity, we are now taking some telephone applications, and right now you would call that service center line to find out how to do that. But yeah, so at a limited capacity, and we're working on improving that as we speak. We are accepting a limited number of telephone applications. And then there was a question about any type of expectations, adaptations, or resources during shelter in place. So I'm not really sure how to answer this question, but really, as I mentioned earlier, we're really pushing for making use of our telephone and online services. Again, we do have limited services available at our offices, and just to kind of give a heads up, if any applicant or recipient wants to go to our offices, that they should be aware that we do practice social distancing measures, and having face coverings and all of that to get services at our offices right now. But yeah, otherwise, again, the good thing about the Medi-Cal program is it largely doesn't require any type of face-to-face interaction. If a client has questions about a pending application, they will get a notice informing them of who their worker is and what number of their worker is. so they can absolutely call the worker directly to find out more information about next steps for them, what the status of their case is, if there's anything missing that they need to submit, those kinds of things. You can absolutely call the worker assigned to the application. There was a question about access to live assistance, and I covered this earlier already, and it's you would call either the worker assigned to the application if it's still a pending application, or if it's already been approved, it's assigned to an office and not to a specific worker. So you would call the service center line that I showed in the earlier slide. And then the next question was about how unhoused clients would have their documents ready if government offices are closed. So the good thing about this is, from what I'm hearing, is that some, if not a lot, of the government offices are now starting to open up again. And if not, there are a lot of online services that they now have. So I encourage any applicants or recipients to look at that individual department or government entity's website and see what kind of online services they have. But, and I'm not really sure what specific types of documents were in mind with this question, but when it has to do with, for example, identification, if an individual has already had a Medi-Cal case with the county in the past, and we have that on file, then we wouldn't even need to ask for that type of identification again. So social security cards, IDs, for example, birth certificate, if we already have those on file, we don't need to ask for that again. Or if we're able to verify the individual's identity online using the state system that we also have at our disposal, then we wouldn't even have to ask for it. So a lot of verifications for Medi-Cal, if we're able to verify them online, we don't need to ask for it any from the client anymore. And then, for example, if there are any type of changes in income and the client is not, for example, able to provide proof that they've lost their job or that their income has decreased or something like that, there are temporary provisions in place where we're accepting a lot of self-attestation. So definitely work with the worker assigned to the case for, especially for applications, for new applications, to figure out, what can and what cannot be written on a sworn statement, for example. And then there was a question about how do people without access to technology, how can they access their benefits? So again, if there is absolutely no access to the internet or the telephone, again, there are still people at our offices that can definitely assist with cases. Granted, it's limited and it may take some time, and there is a line that'll form at the front of the office. But yeah, absolutely, there are still people who can help you at our offices. If an applicant so chooses to do so, and go to one of our offices. There was also a question about if the renewal or SAR dates have been pushed out. I can't really speak so much for the other programs like the cash programs. My understanding is they have pushed those renewal dates out and those SAR dates out for like CalFresh and CalWorks. The good thing about Medi-Cal is Medi-Cal does not require a SAR, or it's more commonly known as a mid-period report. We only require the annual renewal. Unfortunately, the state has not gotten federal approval to push out the renewal dates for Medi-Cal. So right now, the Medi-Cal renewal dates are staying the same. So if it was due in April 2020, it will stay due in April 2020. Now, the good thing about that, the good thing about that is in this situation we're in right now, the state, the DHCS, Department of Healthcare Services, they've issued guidance to counties that we're not to terminate anyone's benefits because of their renewal being overdue. That's not to say that we won't process these renewals as soon as the public health emergency ends. We will be processing that backlog of renewals from March to however long this lasts. But no one is going to be discontinued because they missed their renewal during this public health emergency. Now, that leads to the last question, which is when should they provide their document? When should clients provide their documents to prevent a break in aid? My recommendation is to still submit things as if they were due regularly. So if you have a renewal due in April, my recommendation is still to submit that renewal in April. We won't be processing it until the end of the public health emergency, but it'll be easy, it'll be faster for the county, and it'll be easier for the client, and it'll definitely prevent a break in aid if at the end of the public health emergency, it's already on file and we can just process it, review it without having to wait for it, and potentially the system that the county uses may terminate the case inadvertently. So yeah, absolutely. Now I keep saying the end of the public health emergency. I'd like to clarify on that as well. Right now, we don't know when, we don't, it's a sad thing, but we don't know when this whole situation is gonna get better really. And so we're seeing, things kind of getting better and then kind of getting worse and then getting better again. So right now, DHCS has not provided a specific end date for the public health emergency. So more guidance to come on that. Basically, they're going DHCS is basically seeing how things are going to go, and when when they see that things are kind of getting back to how it was before, then that's when we'll start processing the backlog of renewals and kind of get back to how Medi-Cal was previously operating. Okay, so let me go through the chat first and see if there are any questions. So questions about PruCall. I believe the Department of Healthcare Services has a lot about PruCall. Tammy might have some answers as well, and she'll kind of jump in to add to what I have to say sometimes. But yeah, absolutely. I think your best resource with regards to Medi-Cal and PruCall would be the Department of Healthcare Services website, and I believe they also have links to other resources over there as well.
Juan,
Yes.
for protocol, I'm not sure if you went over the categories, but people can look up Form MC13, and there are categories there that fall under the protocol categories, and the Social Security website has more detailed information on it too. We can also send over any resources that we have for protocol.
Right, absolutely. And so, sorry, excuse me. The MC13 is basically the form that most individuals complete to attest that they have PruCall status. And that form is definitely very informative, and it kind of, it really does go into detail about the different categories of PruCall that an individual may be under. So definitely that is also a resource. And that's easily found online. That it's going to be most likely the first search result when you Google it. Okay, and there's a question clarifying about the status of our offices. So our lobbies are closed, but there are still individuals, there are still staff working for limited in-person services. So they're not completely closed, but we're limiting the amount of people that are coming in. I can't really say how many people that is, but like, for example, for our general assistance program, a lot of our individuals applying for that are homeless and they don't have access to a phone and they don't have people assisting them. And the thing with general assistance is it requires a face-to-face interview. And so we try to set up telephone interviews with the people applying for general assistance, for example, but not everybody can do that. And if they say that they don't have access to a phone, then we still do, for example, their face-to-face interview so that we can get them on aid. And again, if you want to submit documents, for example, we do have a Dropbox in there in front of our offices that you can still submit your documents to. Again, if you need, if an applicant needs to ask for some type of document, for example, they want to complete their renewal, they know their renewal is up and they haven't gotten anything in the mail, and they're not, they don't have access to a phone, for example, and they want to just pick up a new renewal form, they can do that as well. Some questions regarding your aid, you can absolutely do that as well. But we're really limiting the number of people who are in the office at one time, practicing social distancing, practicing having face coverings again, just to prevent the spread of COVID-19. But absolutely, if I would say, like, if you don't have any other choice but to go to the office, if you can't access assistance over the phone or online, absolutely you can go to our offices. Um, right. Okay. And then so there was a question
I
about.
think we missed a question on the authorization to access client's case. So it says, how do we get authorization to access client's case?
Oh, okay. I think I missed that. Yeah, sorry, I missed that one. So, yeah, so authorization to access a client's case. There is a form that you would need to complete to be an authorized representative, and I believe it's the MC 382 and 383. So the 383 is if you're part of an organization, for example, um, and you're so the 383 is kind of where you would write the information about the organization, and the 382 is where you would write the individual in that organization who's going to be mainly assisting with the case. So actually, I don't want to throw you under the bus, but Tammy was the one that kind of revamped the process. Not to say that she wrote the forms or anything, but she kind of revamped our guidance on it, because these forms are fairly new. I believe we only implemented these forms 2 years ago. But yeah, so you would go with the client would have to complete MC um, 382, and I believe the organization would complete MC 383, and it would have the client's information there, the authorized representative information, as well as the signature of the client, authorizing individual to be their authorized representative. And that's the varying degrees. Either they can authorize you to just ask about the case, or they can go as far as to saying that I also want this person to receive a copy of the mail that I'm getting. So that, for example, an authorized representative can complete a renewal on behalf of a client, for example, if they so choose to allow the um, authorized representative to do so. There is also a question here about the working disabled program for Medi-Cal and what would be the eligibility for the program, and could they be completed with an eligibility worker? So absolutely. So as part of the non-Magi, so Magi and non-Magi are just broad groups, but within those groups there are, like, um, I'd say hundreds of individual different programs that we evaluate individuals for, and that is one of the things that we that counties are supposed to be evaluating for. The requirement for that, off the top of my head, I don't know all of it, but I know that there's a minimum amount that you have to be working, or that you have to be getting in income. And
Juan, I have the requirements pulled up for
Sure,
that.
go ahead.
So I'm just the requirements. The first is that they obviously have to be a resident living in California. The second is that they have to meet the federal definition of a disability. So if they receive Social Security, they do meet that definition of disability. If they don't receive federal disability income, then we would have to send in a disability determination packet. And that usually takes a few months for that determination to come back. The third is that the client has to be employed part-time, full-time, or self-employed with countable earnings below 250% of the FPL. And that's where the name comes from, the 250% working disabled person. The fourth is they have to meet the eligibility requirements of the SSI-SSP program. They don't have to receive SSI-SSP, but I believe there are income and property limits for the SSI-SSP program. And they should be able to provide proof of employment and be able to pay the monthly premium that comes with the 250% working disabled program. And I think that's it for the requirements for this program. But if the client or the authorized representative asks to be evaluated for the working disabled program, our workers, our staff can definitely determine eligibility for that.
Absolutely. And kind of just to add to one of the points that Tammy mentioned, that you have to, for example, someone who's receiving disability benefits, if, for example, you're receiving RSDI from the Social Security Agency that that used to be disability, but then has now switched to retirement services, to retirement benefits, as long as we're able to establish that they were previously disability benefits, then I believe you would still qualify for the 250% working disabled program. Just to add a little bit, kind of a tidbit to that. Yeah, I don't think I see any more questions in chat. But if anyone still has any questions, please feel free to ask away.
Can I also add one more thing about the authorization to access cases for the clients? So Juan did talk about the two forms, the MC382 and the MC383. But if you were to call with the client into our call center, and the client tells the worker on the other end that that you can access their case, that should be enough for you to. So when the client says that they allow you access to their case, the worker should be filling out that MC382 and then entering that into our system. And then after that, anytime you guys call in, you guys should be able to access the case without needing the client on the line too. So the question that just popped up, would it, the MC383, would it be for an organization covering their MCAL? I'm guessing that's Medi-Cal. Yes.
Yeah, go ahead, Tam, sorry.
Oh, sorry. Okay, so yeah, so the MC383 is required for organizations along with the MC382. The 382, as Juan said, was to list the individual's detail, while the 383 is to list the organization's detail. So if you are part of an organization helping a client, you would have to turn in both the 382 and the 383.
Yeah, and I think it'll be a lot clearer if you're face to face with the document. But so for example, on the 383, you would write the organization's information. So for example, CHCN, and then say there are two people that are mainly assisting with this client's application. You would list person A and person B on the 383, and then you would have a 382 for each of those two individuals, of course, signed by the client saying that I authorize person A for this, this, and this, and I authorize person B for this, this, and this. So the 383 is kind of the overview of who in the organization is authorized, and then you would need a 382 for each of those individuals as individual authorized representatives, if that kind of helps. Okay, but so I'm not seeing any more questions, but so again, thank you so much for having us, and thank you so much for listening to the presentation. I thank you to everyone who came to the presentation.
Yeah, thank you, Juan, and thank you, Tammy, for joining us today. There's a lot of good information, a lot of great questions. I also just wanted to wrap up and just give you sort of a preview of what other trainings are coming up this month. So if you take a look, we have cultural humility and health disparities related to COVID on the 21st. We also have a mental health and self-care training coming up on the 15th. And then we will be sort of piloting our empathy effect, which was typically an in-person training. And I think it's going to be a 2-hour training on July 28th. So we're going to pilot it virtually. So feel free to sign up for any of these trainings through our training portal, which is how you signed up for the training you attended today. And if you have any questions, you can always email myself or Yadiel, or there's also a Care Connect trainings at chcn.org email you can use if you have any additional questions. Again, I just want to thank you all for joining us and taking the time to be here with us today. And hopefully you got 3 minutes back. So just a little bit of time, but thank you. And we'll see you at our next training.